following segment may contain sponsored content paid for by advertisers. The opinions and views expressed belong to their sponsors and not those of Nexstar Broadcasting Incorporated, this station, or their affiliates or employees. You're watching Central Illinois Newsday.
Springfield Clinic's Dr. Tyler Evans joining the show this afternoon to give us some insight on a technique used in plastic and reconstructive surgeries. Hi, Doctor. How are you?
I'm doing well, thanks. How are you?
I'm doing great. Thank you for asking. Well, first, let's talk about this Walant surgery technique. What is it?
So, Walant surgery is a technique that plastic surgeons kind of developed a few years ago. That really is, it stands for wide awake, local anesthesia, no tourniquet. It's a type of hand surgery that you can do in the office. The way that you do it is you don't use any sedation and you just use local anesthesia like a lidocaine. And basically no tourniquet, so you have no tourniquet pain either. It can be done in the office, and there's a variety of procedures that can be done with this technique. But it's great because you don't have to go to the hospital and all these things. So you can do a wide variety of these hand surgeries just with local anesthesia only.
And what kind of hand surgeries can be done utilizing it?
Sure. So the most common ones are carpal tunnels and trigger fingers. I would say the majority of those is what we do. But you can do a wide variety of things just under local anesthesia, including basic hand fractures, tendon injuries, both flexor and extensor tendon injuries. You can even do arthritis type surgeries like CMC arthritis, which is the arthritis that you get in the thumb that you can treat for pain purposes. So it's just basically anything minor procedures that you do on the hand you can do with this technique.
It's very interesting. Now I'm curious, are there any benefits?
Yeah, absolutely. I mean, you avoid the whole process of going to the hospital, and I think especially nowadays with COVID-19, a lot of people really want to avoid going into the hospitals and exposing themselves with the risk of COVID-19. So to avoid that, you can just have the procedures done in the office. And I think that that's a great benefit, especially nowadays for people.
And doctor, what do these hand surgeries mean for a patient's quality of life?
Yeah, I mean, I think it really significantly improves their quality of life. Hand surgery in general for carpal tunnel trigger fingers can really change somebody's, pain level as well as the numbness in their hands. It really can kind of help utilize their hands better in a day-to-day life. So. Specifically in the office, it helps them not have to spend the time to go to the hospital. They can avoid sedatives that they are given in the hospital to help them go to sleep. So it can really improve their quality of life by not having to have people drive them to the hospital. They can drive themselves to clinic, to and from, so they don't have to worry about getting somebody else to take them to the hospital. So I think it just greatly benefits them.
And what other services or procedures do you offer?
I offer kind of the full range of plastic surgery and hand and upper extremity surgery. So I did a hand and upper extremity fellowship on top of my plastic surgery training. So I do all of plastic surgery, like the reconstructive plastic surgery, breast reconstruction, cosmetic surgery, as well as I do a lot of pediatric plastic surgery, including cleft lip, cleft palates, and skin lesions on children and adults. And then the wide variety of hand and upper extremity surgery as well, as including carpal tunnels, trigger fingers, hand fractures, wrist fractures, forearm fractures, tendon injuries, arthritis surgery, and even joint replacements for the hand and wrist.
Well, doctor, we have about 30 seconds left. So is there anything else you'd like to mention while we've got you on the show this afternoon?
I just think that, I think people nowadays are hearing more about in-office procedures, and I think that given, the current state of the pandemic, I think that, more and more people are choosing this route, and I think that, I can provide that service, within the hand and upper extremity realm, including even plastic surgery procedures in office as well.
Well, Dr. Evans, thank you so much for your insight, your knowledge, and for joining the show here on Central Illinois Newsday. We greatly appreciate your time.
Absolutely. Thank you for having me.
Of course, it's my pleasure. Well, for more on this interview, more information on Springfield Clinic, visit our website, ciproud.com. We have all of that listed there for you. CI Newsday will be right back after this.